So can you tell us a little about the ARREVE study?
Yes. So it's a very interesting study, a large observational study that compared two approaches to taking patients off the ventilator when they're imminently dying. The two approaches were immediate extubation versus what's called terminal weaning. And so these investigators compared those two approaches and looked at outcomes including patient symptoms. They surveyed family members for symptoms of psychological distress, and they also surveyed nurses and physicians. And it was interesting, what they found was that in the immediate extubation group, the patients experienced more gasping, and there was a little bit more airway obstruction. There was no difference at all in terms of the family outcomes. And for the assistant nurses, no different for physicians, but for assistant nurses, there was actually more strain with the terminal weaning group. So for patients, it seems like they were more comfortable with the immediate extubation. The nurses had a better experience with the terminal weaning.
What would you say makes this study the most noteworthy?
Yes. Well, it's the first study that's compared these two approaches. It's a very important topic and a very difficult area to study, actually. And in fact, the authors felt they could not do a randomized trial because they felt that physicians in particular wouldn't allow their patients to be randomized to the approach that they're not comfortable with. So it's an observational study. It's large, it's multi-center, but they didn't randomize, which is really one of the main problems with the study. The patients in the two arms are different, and so are the doctors. And so it can be a little hard to know exactly what the results mean.
So it's been a very interesting study, noteworthy you said, but there were some limitations and some strengths. So can you speak to those?
Yeah, so we mentioned already the fact that it wasn't randomized. That's probably the strongest limitation. But the other limitation I would point to is the fact that a lot of these outcome measures that we're using are not very precise. And that's not a limitation of the authors, it's actually a limitation of the field, and one of the areas where we need much more work. I think the strengths are that it was large, it was multi-center, and if you look at the hospitals that were using either of the two approaches, most of the hospitals used both approaches, which to me suggests that there is a certain amount of randomness, and the results are probably going to be helpful in informing the way we go forward.
So where do we go from here?
Yeah, so good question. I actually personally believe this is a little bit of a false dichotomy, that the immediate extubation versus terminal weaning, probably it's not either or, but probably what we need to do is to develop protocols that allow us to understand which approach is best for which patients. And then as intensivists, have an array of tools in our toolbox that allow us to meet the needs of individual patients and their families. And so I feel like the way forward is to develop a protocol that's adaptable, that can be applied to individual patients and families to meet their needs, and test that as a way to improve this important process.